Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. I apologize in advance for the length of my remarks today, but I have a lot of important information to share. Today, I would like to provide you our daily numbers and then update you on phases 2B and 2C of our vaccine rollout. Over the last 24 hours, we have identified 364 new cases of COVID-19. We've completed about 6,600 tests, and our positivity rate is about 5.5%. We have identified 65 new cases involving variants of concern. Over the last week, our R value province-wide was 1.07. We must all redouble our efforts to follow public health measures so we can drive Alberta's RT value back below 1. Looking to schools, there are currently active alerts or outbreaks in 250 schools, or about 10% of schools in the province. These schools have had a combined total of 1,106 cases since January 11th. There are currently 255 people in hospital, including 42 admitted to the ICU. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. My deepest sympathies go to the family, friends, and colleagues of these individuals and anyone who has recently lost someone they loved to any cause. In Alberta, we have now administered more than 368,000 doses of COVID-19 vaccine. Every dose is possible thanks to the hard work of hundreds of different healthcare workers. I would like to recognize the many, many people at Alberta Health and Alberta Health Services, as well as the frontline workers at immunization centres and community pharmacies, and soon to include community physicians who are working very hard to protect Albertans through immunization. Today, we started Phase 2A of our rollout, which includes anyone born in 1956 or earlier, and First Nations, Métis, and Inuit people born before or during 1971. Staff and residents of any licensed seniors supportive living facilities not included in Phase 1 are also eligible for the vaccine. There has been strong interest, which is a great sign. As of earlier today, more than 8,000 Albertans had booked appointments through AHS, and thousands more had booked through participating pharmacies. I'm so grateful for everyone who is signing up. I know many others are eager for their turn, and we are asking everyone to please be patient. More than 437,000 people are eligible under Phase 2A. AHS is booking one birth cohort at a time, and tomorrow they will open bookings for the next birth year. Please check the AHS website to see which birth years are eligible to make appointments. Bookings for the new cohort will go live tomorrow at 10 o'clock to allow some improvements to the online booking tool to be made. Of course, pharmacies continue to book appointments for everyone included in Phase 2A, no matter what year you were born. If AHS is not booking online for your birth year yet, or if the pharmacies near you are all full right now, please don't worry. More appointments will be available in the coming days and weeks as more doses arrive. Everyone in Phase 2A will get their vaccine. No one will be left behind. Once we've completed this phase, we will move to Phase 2B. As you know, in 2B, we will offer the vaccine to Albertans with severe underlying conditions. I know many Albertans have been anxiously waiting to see if their condition will be eligible. I appreciate their patience and recognize that many, many people will benefit from this vaccine. Every single Albertan is deserving of it. However, we have limited supply, and so we'll once again be focusing on those most at risk of severe outcomes. We have now posted a list on our website of underlying health conditions that will be eligible. This list is based on the recommendations of the Alberta Advisory Committee on Immunization. The health conditions that we are prioritizing were carefully considered based on our experience in Alberta and evidence from around the world. All of these conditions are associated with a higher risk of death or hospitalization, even in younger age groups, when comparing their risks to those for people aged 50 to 64 with no underlying conditions. These conditions are complex, and every patient is unique. I encourage everyone with underlying conditions to check the website to see if they will qualify. Among the many conditions listed, you will be eligible to receive the vaccine under Phase 2B if you have chronic heart disease, if you have received a solid organ, bone marrow, or stem cell transplant, if you have been diagnosed with or treated for cancer in the past year, if you have diabetes requiring insulin or other medication to control, or if you suffer from severe obesity or chronic liver, lung, or kidney disease. Anyone with a severe learning disability, developmental delay, or severe neuromuscular condition will also be able to receive vaccine. This includes those with Down syndrome and cerebral palsy. If you've been hospitalized at any point in the past year for a mental illness or a substance use disorder, you will also qualify. If you were pregnant, you will also be able to get the vaccine. I appreciate this list is complicated, and there are also other illnesses that fall under these categories that I did not name as examples. As I mentioned, a detailed list of conditions eligible for vaccination in 2B is available on our website at alberta.ca. I know the first question that many people will ask is whether they'll need a doctor's note or other proof of a certain condition. You will not. We will be operating on the honour system, which is the same approach being taken by Ontario and other provinces. However, anyone with one of these conditions can, if they wish, consult their healthcare provider before booking their appointment. When Phase 2B begins, we will approach it in the same way that we are approaching Phase 2A. All eligible Albertans will be able to book via pharmacies right away, and AHS will open bookings in stages, going by year of birth. Along with this information about Phase 2B, I also want to provide more clarity for who will be eligible to receive the vaccine when Phase 2C begins later in April. As we announced a few weeks ago, this phase will offer the vaccine to all healthcare workers who provide direct, in-person patient care or provide immunization services. This means physicians, nurses, pharmacists, dentists, and all other regulated healthcare professionals and their office or support staff who are in direct contact with patients will be eligible. For Alberta Health Services, Covenant, Alberta Precision Labs, and Dynalife, this means people working in patient care facilities and those providing services directly to patients in the community. First Nations healthcare workers on reserves and students undertaking their placement practicums in clinical areas will also be included in 2C. Protecting healthcare workers who have been caring for COVID-19 patients for more than a year provides protection to every patient accessing care across the healthcare system by reducing the risk of healthcare workers becoming infected or spreading the virus to others. We are also including individuals who are the designated family support people for residents living in a continuing care facility, recognizing the important support that loved ones play in care of those at risk. Immunizing these people will help provide additional protection to our most vulnerable seniors. When Phase 2C begins, caregivers of children who have high-risk underlying health conditions but cannot be immunized due to their age will also be able to get the vaccine. Phase 2C also includes sites where people live together in close proximity and those who support them, such as residents and staff at correctional facilities, homeless shelters, and group homes, including those for disability, mental health, and other types of licensed supportive living. Frontline police and transport and court sheriffs who work closely with eligible congregate populations in shelters and correctional facilities will also be eligible under Phase 2C. Finally, we are also including in Phase 2C all employees at meat packing plants, which will help prevent future large outbreaks. Together, these phases represent a vast group of Albertans. More than 660,000 Albertans will be eligible under Phase 2B, and another 400,000 will be able to book in Phase 2C. That is roughly 1 million Albertans, and it will take some time to provide a vaccination to everyone who wants one. We hope to begin these phases in April, beginning with Phase 2B. Exact timing will depend on how many vaccines we receive, but we will keep you updated. As I've said before, vaccines save lives, and their benefits far, far outweigh any risks. I continue encouraging everyone to book an appointment to be immunized when your turn comes. Until then, we must continue protecting each other. We must not let our guard down. We need to continue following the public health measures that are in place, because the more tools we can arm ourselves with against the virus, the better protected we will be until vaccine can be offered to everyone. Thank you, and I'm now happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Kevin Nimick, CTV Calgary.
Hi, Dr. Henshaw. The Ontario Hospital Association says that province is in a third wave. What metrics are you tracking to determine if Alberta is entering a third wave?
As you know, we've been watching our leading indicators very closely, which are our new cases, our positivity rate, and our R value, or growth rate. And as you know, several weeks ago, there was a pause on moving forward into all of our Step 2 activities because we did see a slight rise for a few weeks in our leading indicators. Since that time, the indicators have stabilized, but we continue to watch them because each week really depends on our collective activities. And so if those indicators begin to rise, if we see those new cases start to go up, our positivity rates and our R value, essentially that could mean that we're entering another growth phase. And of course, that would cause some concern about whether or not a third wave could be possible. So again, those leading indicators are the key ones to watch.
Is there a follow-up, Kevin?
Yeah, there sure is. We've heard from dozens of frustrated seniors today who say they called their local pharmacy only to find out that pharmacy had already booked vaccination appointments until May. The pharmacies themselves say that they had the province's permission to book early. Why didn't you share this information widely with Alberta seniors?
So we talked about the fact that pharmacies did need to use up the vaccine that they had in their stock so that that wouldn't expire, and that they were able to then offer vaccine to seniors in Phase 2A a little earlier if they didn't have enough people from Phase 1B taking up those vaccines. We know that some pharmacies have again booked ahead, but I want to assure Albertans that we will have enough vaccine to provide immunization to all those Albertans who are in Phase 2A within the next 3 weeks. And so whether someone has booked an appointment in May, it will be critical for them to continue to keep a close watch on the Alberta Health Services website as new birth year cohorts are opened. And we will also be providing additional vaccines to pharmacies as new shipments come in. And so, again, anyone in Phase 2A should be able to get a vaccine within the next 3 weeks. I recognize it's frustrating when people aren't able to book their appointment today, but over the coming days and weeks, there will be additional appointments, and everyone who wants a vaccine in 2A should be able to receive one within the next 3 weeks.
Operator, could you put through the next caller, please?
Jeff Slack, 660 News.
Hi there. Thanks for taking my question. This kind of just came down, but CBC is now reporting that Canada will change its guidelines on the AstraZeneca vaccine, now allowing those over the age of 65 to receive the shot. So I'm just wondering, I know that this kind of just came out now, but I was just wondering your thoughts on this and if Alberta will adopt this new change.
As you know, we received 58,500 doses of AstraZeneca vaccine last week, and those appointments were offered to individuals who were in the Phase 2D category, which is ages 50 to 64 and 15 years younger for those people who are First Nations, Métis, or Inuit. And so that batch of vaccine is spoken for at this point in time. As you say, I was informed the National Advisory Committee on Immunization was updating its recommendations to include the individuals who are over the age of 64. But what I would say is that those are the individuals who are in Phase 2A, are those who are 65 and over, and all of those individuals will be eligible to receive a vaccine, which at the moment is Pfizer or Moderna vaccine, over the next several weeks. I don't currently have confirmation of when we would be expecting to receive any additional AstraZeneca doses, but we will be looking at the current recommendations. We'll be looking at who would be able to receive vaccine or who wouldn't already have had it offered to them and take that into account. But ultimately, the change in recommendations really shouldn't impact our program significantly because, as I've said, everyone 65 and over is already eligible to receive a vaccine within the next several weeks.
Is there a follow-up, Jeff?
Yeah, I just want to touch on some concerns surrounding AstraZeneca. I know you've addressed this in the past, but it still appears that people are worried about taking this shot, considering all the things that they've seen in Europe that are going on. I'm just wondering, does the province have a plan to address this sort of the same way that we saw ads with COVID-19? Is there anything that more we're going to do to send the message that this vaccine is safe for use?
It's a critical question, and vaccine safety is something that we take extremely seriously. We have been monitoring, not just in Alberta, our own vaccine experiences after people have received the vaccine, but of course watching closely around the world. We've been working with our federal and provincial and territorial counterparts to determine if there is any safety signals in any of the vaccine. And it's really important for people to know that when the issues were identified in a small number of people in a few countries in Europe, again, we're looking at several factors. One of the factors is the incidence of the kinds of health issues that were reported in those individuals and whether or not the vaccine is seen to be associated with those in more cases than you would expect in the general population. And I want to reiterate that there have been more than 11 million doses given in the UK and more than 5 million doses given in Europe. And the number of reported incidents is very small. And in none of the clinical trials and in the data that's been gathered in the UK and in Europe, they're looking at whether or not these kinds of health conditions, again, are happening more frequently in that population that got vaccine than you would expect in the general population. And there's no indication at this time that that is the case. And in addition to that, sometimes when there's a particular lot or batch where there's some issue that's flagged, that particular lot or batch is held back. And as you know, we don't have the same lot or batch that was delivered in Europe. We have a version of the AstraZeneca vaccine called Covishield, manufactured by the Serum Institute of India. Again, we are monitoring the safety signals, not just in Alberta, but around the world. And at this point in time, there's nothing to indicate that the particular vaccine we're using in Alberta is causing any kind of safety signals like the ones that they're seeing in Europe.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Tom Ralston, Global TV.
Hi, Dr. Henshaw. Thanks for taking my question. The city of Lethbridge continues to record its highest case numbers to date through the pandemic. Local AHS officials have told us private indoor social gatherings are a key reason for this. What's your message to these individuals who continue to skirt the rules, and should there be a harder line for enforcement?
I can understand people are frustrated. We have had restrictions on indoor social gatherings for many months now, and we are, as human beings, social beings. So it's very difficult to stay away from our friends and from our family for this long. So I absolutely understand the difficulty and how frustrating it is. But what I would say is we've now seen particularly variant cases of COVID-19, the B117 variant in particular, in every zone across the province. And we've seen many occasions where somebody who's present with a case of COVID-19, they may not even know about it. And if it's the variant case, it does spread farther and faster than even the typical COVID-19 did. So what I would say to those individuals who are feeling like they are impatient and frustrated and want to start having these social gatherings again is that we are close. We are just a few months away from being able to offer vaccine to everyone who is at significant risk of hospitalization or death. And until we get there, these kinds of social gatherings are the highest risk type of activity to spread COVID-19. And the ripple effects can reach far beyond those who attend that gathering. They reach into workplaces, they reach into hospitals, they reach into schools. And so by choosing to hold on just a few more months, you're choosing to protect your communities. And again, I just want to make sure that people remember the choices that each of us make are important, they matter, and it's about protecting our communities.
Is there a follow-up, Tom?
Yeah, is there a threshold at which point we could end up seeing regional restrictions take effect if things continue to go the way they are, considering Lethbridge has such high case numbers where a city like Medicine Hat in the same health zone is considerably lower?
The question of regional restrictions, no decision has been made on that, but certainly if we see rapid rise in cases, which leads to rapid rises in hospitalizations, then additional measures may need to be considered, whether that's regional or what kind of geographic area that might apply to. But ultimately, the last thing any of us wants is to have to go backwards. And the best way to prevent us having to go backwards, whether regional or province-wide, is for all of us every day to think about our actions and put our communities first.
Operator, can you put through our second last caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Just to follow up on what Kevin was asking about pharmacies booking in advance of March 15th, I recognize that you're saying there will be vaccine for everyone who wants one, but how do you address the concern or the feeling that some Albertans have that others may have jumped the queue or had an unfair advantage because they knew to call in advance of March 15th?
I can understand Albertans feeling that it's not fair, that some individuals who booked before today would have gotten an appointment earlier, and I recognize that that's frustrating. What I would say again is that every single Albertan who wants a vaccine will eventually get one, and every Albertan who's in Phase 2A will be able to get a vaccine in the next 3 weeks. And while, again, I recognize that there was some inconsistency in booking practices, and that absolutely can cause frustrations, we need to focus on the fact that we will be making vaccine available to that entire age group. And so I would ask people to be patient. I know it's difficult. I know there are many who eagerly want vaccine and want to get it as soon as possible. And again, I would encourage those individuals to be checking the Alberta Health Services website as their birth year comes up to be able to book vaccine, and to watch for additional pharmacies, additional opportunities as we get more vaccine in the province and more pharmacies are able to offer those appointments.
Is there a follow-up, Julia?
Yes, there is. I also wanted to get your thoughts on the jump in variant cases. There were 65 additional new cases. And just curious, what percentages are the variant cases now of all active cases, and how many of the variant cases are currently active?
I'll have to get back to you on the total number of current active variant cases, but we certainly are seeing a growth of variant cases. We have been able to slow the rate of growth through our interventions, but it is rising. The percentage of our new cases, so again, this isn't the overall percent of active cases, but the percent of the new cases has risen over the last 6 weeks, and we are seeing that percent of new cases sitting at around 11%-ish of our new cases right now, which of course is a concern as we see those numbers rise. We will be putting information on our website this week that indicates the exact day that each variant case was first diagnosed, because we know with some of the lab processes, sometimes there's a larger number of samples processed in a given day and sometimes a smaller number. So we want to make sure that Albertans have access to that daily information that shows what day each variant case was originally diagnosed with COVID on a graph over time, so you can see the different types of variant cases and that daily change.
Operator, could you put through our final caller, please?
Thank you. James Keller, Global.
Hi, Dr. Hinshaw. Just back to the variants to follow up on that last answer. What is the testing capacity currently? I know that initially we were talking about 300 tests per day for the variants, but obviously that wouldn't be enough to keep up with the positive cases we're seeing now.
I haven't actually asked the lab lately what our ceiling is. What I know is they have told me that they do have the capacity to be able to test every single positive case for variants. And, you know, that ceiling, certainly we had that capacity in January for 300. They've pushed beyond that now. But I'm actually not sure what their ceiling is, so we'll have to get back to you on that.
Is there a follow-up, James?
No, that's great. Thanks a lot.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening.